What's the right age for laser treatment?
Facial laser treatments are very popular and can be highly effective for skin rejuvenation as well as for the treatment of skin growths, prominent blood vessels, and skin discolorations. Certain laser treatments are performed aggressively for some older people expecting to achieve a lifting effect in order to avoid having to have surgery, such as a facelift. This strategy typically is not only ineffective but oftentimes results in damaged skin and you looking worse than you did before you had the treatment. In my opinion, aggressive advertising online and in social media is significantly responsible for this phenomenon occurring. In addition, there is a growing trend of increasing numbers of younger people who are undergoing unnecessary and damaging procedures to their skin. I'll discuss how I evaluate my patients and determine when a laser or thermal energy treatment is appropriate for my patients who come in to see me in my practice. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. I own several different lasers and radiofrequency devices in my practice so I can choose the best option for my patient based on their age, condition, skin type, and other factors. And I also routinely perform facial cosmetic surgery such as upper and lower eyelid surgery, facelift, brow lift, facial implant surgery. This of course means that I'm not limited to only having to use non-surgical devices like the majority of medical retailers. If a patient I see would be better off having surgery, I'm able to perform the appropriate surgery they need. In my practice, I also routinely use non-surgical procedures including fillers, neurotoxins, lasers, radiofrequency, and regenerative medicine technologies to help my patients look their best. Although I'm a surgeon, I enthusiastically apply non-surgical solutions with the benefits of insights derived from my surgical experience. So what do lasers and thermal energy devices do? They generate heat directed at specific targets within the skin. A common goal with these technologies is to induce collagen production to restore collagen lost from aging, as well as from other causes such as sun damage and acne. The process is to induce a controlled injury into the skin in order to initiate a repair mechanism by cells called fibroblasts in order to produce collagen as part of the wound repair process. An example of this concept is illustrated by a procedure I routinely do, called a fractional CO2 laser, to the lower eyelids in order to improve the appearance of wrinkles and pigmentation. A CO2 or erbium laser removes the outer layer of skin called the epidermis and delivers heat to the deeper layer of the skin called the dermis. During the healing process afterwards, a new layer of epidermis gives the skin a fresher appearance. At the same time, thermal energy delivered to the dermis results in thickening and tightening of the skin. I'm frequently asked about the right age to do any laser procedure. The answer, of course, is it depends. The clearer you are about what kind of result you want, the more precise I can be in selecting the appropriate laser for your skin issue. I'm particularly concerned about a trend where younger people are undergoing so-called rejuvenation procedures, which are generally used for people who are at least a decade or older than they are. There are some situations where someone in their 20s can benefit from laser-based skin treatment. For example, we can use a 1064 YAG laser for the treatment of active acne or unwanted hair. I routinely use an erbium laser for the treatment of benign skin lesions like moles and skin tags. I use a Q-switch laser for tattoo removal, as well as other types of pigment issues such as brown spots related to excess sun exposure. For a patient in their 20s and 30s who have problems such as acne scarring, I avoid performing procedures where high temperatures are delivered to the deeper layers of the skin. Currently, this high temperature concept is being promoted as the most effective way to induce more collagen as a response to such an intense treatment. Generally, the results from these devices have not been very impressive, and the patients who come to see me after having these procedures done elsewhere are very disappointed. Without getting overly technical, there is a presumption that high temperatures for specific time durations directed into these scars will induce more collagen than any other process could. In my opinion, the tissue within acne scars have a limited capacity to respond significantly to these treatments. I'm also concerned about younger people having such aggressive treatments and the negative impact there is on their skin as they grow older. My approach to acne scars is to try and leverage the benefits of regenerative technology such as PRP or platelet-rich plasma and avoid excessive heat-induced injury to the skin. PRP is a concentration of the wound-healing elements of your blood which induce collagen production, again without excessively heating the skin. I do recognize the value of some laser-based stimulation of the skin. I'll often use a non-ablative laser, which is a type of laser that leaves the outer layer of skin intact. I'll frequently use a non-ablative laser such as a 1064 YAG laser to induce microscopic collagen stimulation in the dermis and also apply PRP and hyaluronic acid directly into the acne scar. This approach induces far less injury and allows for the generation of healthier skin through a safe approach without any significant downtime. As far as age-related changes to your skin, it's typical to notice in your mid-30s and later how your skin loses some youthful luster and glow. I often use a Q-switch ND YAG laser to stimulate collagen production in the skin that can be compared in a way to building muscle strength through weightlifting. Keeping this concept in mind, I routinely use PRP to help create an environment for optimal collagen production. Improving the surface or epidermis as well as the dermis can be performed with a long pulse erbium laser, particularly for the thin and delicate skin around the eyes, which we refer to as the smooth eye procedure. A lot of my patients who are in their 40s and older become more aware of deeper lines and loss of facial volume. In order to address these issues, I often combine several modalities to create a more youthful appearance. In addition to the use of lasers, for example, I'll address under-eye wrinkles with a fractional CO2 laser, which is an ablative laser. The fractional pattern used with this laser allows for the skin to heal faster than with a fully ablative laser, while still achieving comparable results. As I do with non-ablative laser skin toning, I use platelet-rich plasma or PRP to further optimize the results of the fractional CO2 laser treatment. In situations where my patients want to improve the appearance of the crow's feet lines around the eyes, I'll use a neurotoxin like Botox or jowls to reduce the muscle activity in this area responsible for the development of these wrinkles. For some people, there can be some mild skin sagging and fat at the jawline resulting in the appearance of jowls. We can actually use a long pulse ND YAG laser to perform a non-surgical jowl lift through the precise application of heat to reduce fat as well as tighten skin to improve the jawline definition. Of course, in the 50s, 60s, and older, there is more significant skin laxity that cannot be addressed only with a laser or thermal energy device. This is important to understand, since aggressive marketing intentionally deceives a lot of people to believe that they can avoid having surgery like a facelift with a non-surgical treatment such as a radiofrequency-based heating device. Overly aggressive heating of your skin not only compromises your skin's health and integrity, but can also negatively affect the fat layer just below the skin, which is critical to healthy and youthful looking skin. Overheating for the purpose of tightening the skin can literally cook this fat layer, resulting in facial volume loss and making you look even worse than you did before you had a treatment. Over the age of 50, I look first at the foundation of the face, which is the bone structure. Bone volume loss has a significant impact on the tone of your skin. Diminishing bone support causes the skin to appear to be loose. Ironically, practitioners who are promoting thermal energy devices claim that your skin will be lifted with their devices, when in actuality they're attempting to shrink wrap your skin to get it closer to smaller bone structure. The other aspect of facial aging over 50 is loosening of the skin and underlying support. I determine in my examination what is the most significant issue. Is it bone volume loss versus skin laxity? When bone volume loss as well as soft tissue loss is the major issue, I recommend a procedure called structural volumizing. This is a technique where we use long-lasting hyaluronic acid fillers which are placed at the foundation or bone level to restore definition, particularly in the cheeks, chin, and jawline. As opposed to thermal energy devices claiming to be alternatives to facelift surgery, structural volumizing actually delivers results that look like you've had a facelift. In situations where skin and supporting tissue laxity is more significant, then a surgical procedure such as a facelift would be much more appropriate. A common fear which contributes to people looking for facelift alternatives is the fear of undergoing general anesthesia. My patients who come for consultations for facelift are relieved to learn that I perform facelift surgery under local anesthesia with light IV sedation in my office operating suites. Lasers can still be used at this age and older to improve skin texture and the quality at the same time of undergoing a facelift. I use lasers to improve the appearance of vertical lip lines, commonly referred to as smoker lines, and other areas of lines which are significant. I look at lasers as tools in a doctor's toolbox to help my patients look their best. In the current environment, medical retail establishments are typically staffed by non-physicians, such as technicians, estheticians, and nurses who simply lack the level of training and experience of core-trained doctors. These retailers market by device brand name and offer financial incentives to buy the services they're selling. Do you think there's going to be any consideration of all the options which may be appropriate for you? Probably not. There's a big difference between a retailer selling to you and a physician who's advocating for you. I've seen that people who are most vulnerable to these medical retailers are often people with financial limitations or limitations in understanding of the benefits and value of higher level medical expertise. Unfortunately, these same people who will spend less on a retail service will then spend a lot more for experts to deal with their complications and poor outcomes. I can state with confidence that investing in your safety is much better than self-diagnosing and finding a medical retailer who will happily sell you a laser treatment. Your skin does not have a reset button. I hope you found this information helpful. Thank you for your question.